What role do parents play in their child's therapy? Often, when parents first arrive for therapy with their child, they can be really unsure of what should happen next. There's a common tension that exists for parents in wanting to help their child and the therapist, but also not wanting to interfere. This can be particularly hard around how involved they should be at the start or throughout sessions if their child's struggling to be in a room on their own. It's really important that we try and ease parents' concerns around this to take the pressure off them and make sure that they're clear on how best they can support their child. Some things that people can think, which aren't always true, are around how present a parent should or shouldn't be. And it's not an all or nothing decision here. What's really important, particularly what I feel is really important, is what works for their child. And especially at the start of therapy, if your child is very nervous, then actually you as the parent think should be closer to them and more involved in sessions. If, however, your child's happy to let you go and they come in on their own, that's fine too. That stepping back doesn't mean that you're not engaged or that you don't care. But what we're always looking for is to make sure there's some structure and agreement, and also that we respond to the needs of your child and to you as the parent. Some key points to think about in this are that firstly, therapy needs to be a safe space for the child. When a parent is present, then they often feel more regulated and the pressure to be there on their own reduces. This helps your child then become more independent in the session and build some trust and safety with the therapist in that relationship. What we don't want to do is create a separation where that raises the child's anxiety. So actually them being in the room is a very, very stressful experience. We want the space to be safe enough for them to express and to share and to play. Secondly, parents do play a really important role, and we want some intention in that. And we want to think about how we can do that and guide parents to best be involved. Sometimes what we find is at the start, parents are more involved and then they go, and then there'll be specific points that will bring them in. But what we want to try and do is make sure that parents can provide the consistency, and particularly consistency between therapy sessions and home life. We recognize as therapists that parents parent differently and that they respond differently, and nobody's perfect. So we want to make sure that if we're asking parents to do things to support therapy with some guidance, that we're really tailoring that to the needs of the parent and to the child. Things can change. And what I mean by that is how much we need a parent or not need a parent can change. So the early stages can look very different to the middle or ending stages of therapy. Particularly for trauma therapy, something like EMDR, the role of the parent can be very critical, particularly when we move into processing trauma. And it's really important that we have a safe caring adult there with the child. It really supports the therapy, but it might not be that they're involved in that the whole time. We're also looking at increased confidence for the parent and for the child. And where children begin to feel more safe and comfortable, they're more flexible, and so are parents. So we're always reviewing these things. Really fundamentally, in terms of changes, is that the process of therapy needs to adapt to the child. And so we don't want things that are too fixed or too rigid, but we are reviewing and we're making agreements and deciding what's in the best interest of the child and you as a parent. So my final thoughts of this are that progress can actually be really improved by a parent having a clear understanding of their role and how supportive and involved they need to be and when they need to step back. Children feel safer when their parents feel more at ease. And if there are clear expectations, then we can approach that very calmly and consistently. Really, really important. My final point is that therapy is meant to be a collaboration. Yes, your child might be in a room on their own, or we might be working towards that. But the more we can collaborate with the parent included, that doesn't mean that we're telling them everything that we talk about or everything that happens, but having a two-way conversation with the parent and the child, included or not included as needed, really, really, really supports therapy. So, parents, you are the key to therapy progressing more quickly and making more fundamental changes.